So as I was saying, I really want the session to be as interactive as possible, just because we'll be covering a lot of your personal Instagram pages, and we'll be doing a lot of other case studies as well. Sorry about that. Just quickly mute that. Fabulous. So I would like to start by everybody introducing themselves if you can. Feel free to flick on your camera as well. If not, then that's completely fine as well. Just tell us your name and maybe your profession as well. Okay, I see
Hi,
Dr. Hello. Lovely to see
Doctor. Me too. I'm so excited for this session. I'm a good study case, I'm sure.
No, your account was really interesting. I can't wait for a really good discussion there.
Yeah, I'm looking forward. I'm Dr. Marihan. I'm GB static.
Okay, GP aesthetics, awesome. We'll go to Dr. Zaida maybe.
Yeah. Hi guys, good evening. Well, I'm not a doctor, I'm just the clinic owner.
Okay, clinic owner,
But
cool.
I can call myself as a doctor. I've been on all your trainings and whatever is possible. I think I can do complete consultation to the customers also. Nice to see you. So my name is Zaida. I'm the founder and creative director of Zaida Beauty Lounge and Zaida Clinic. So I'll be attending this training session with pleasure.
Awesome. Thank you so much. And then we've got Dr. Mariam.
Hi, I'm also not a doctor. Um, I've just launched my venture called Companion. And basically, what I do is I'm guiding and supporting and coaching patients who fear anxiety towards medical procedures, any medical procedures.
Awesome.
So, and also I combine it with holistic approach. And I am planning to actually um, do also things for clinics and hospitals and coach them coping with patients with anxiety. So that's in short what I'm doing.
Awesome. Thank you so much for that. We've got Dr. Farzad.
Is it me?
Yes, I
Thank
think
you.
so. Dr. Dua or Farzad, I'm not sure.
Okay, that is my name. Yes, so I am a pharmacist and a cosmetologist under training. Studying. I work in a pharma industry, so I'm basically on the other side of the table. I have a passion for the beauty and aesthetic industry, and happy to be here with you today.
Thank you so much. And lovely seeing you the last time as well.
Thanks.
And then we've got Dr. Rahman. Sorry, I know your son is running around, you said, but if you're comfortable, feel free to let us know.
Yeah, sure, sure. So I'm a chiropractor and I own my own clinic. And yes, I'm all about integrated holistic approach in terms of treatment wise for my patients. But yeah,
Okay,
awesome.
awesome. Anybody else who would like to jump in? A couple of names got jumbled up. We've got Dr. Ella, Dr. Ikra, who haven't spoken yet.
Hi, I'm
Hi.
Oh, sorry.
hello, how are you guys? Nice to meet you all. So I am Dr. Ikra, I'm an aesthetic doctor, and I do all things anti-aging, all injectables. So it's nice to be part of the meeting.
100%. Thank you so much for coming.
You're most welcome. Let's see, excited.
And then we have Dr. Ella. I think you want to say something as well.
Hi, good evening. It's actually Michaela. I just renamed my
Ah,
daughter is Ella. Sorry, she was using it last time. I have been on many meetings, so I believe most of you know me who are newly joined. I'm GP Aesthetics, and if you will be continuing with Invicta, you will for sure meet me at some point. Have a nice evening. Looking
thank
forward
you.
for this session.
Awesome. Has anybody not spoken yet? Dr. May, you just joined. Dr. May is one of our new joining members. So Dr. May, I was just discussing with everybody that I want the session to be as interactive as possible. So I'm having everybody introduce themselves just for a couple of minutes here. So if you can just give us, maybe you can unmute yourself, feel free to turn on your camera if you wish so, and just, yeah, tell us who you are and your profession. Dr. May, can you hear me?
Yeah. Oh, hi. Yes, can you hear me?
Yes, I can hear you.
Yeah. Hi, everybody. How are you? Thank you so much for today's meeting. I am a pediatric dentist at Dr. Michael's. I've been practicing in Dubai for 10 years now, and I'm looking forward to doing more courses with you and knowing more about personal branding and yeah, and personal development in this course. Thank you.
Awesome. Thank you so much for joining. Okay, cool. So we can kick off our session today on case studies of Instagram. So I feel like a lot of the time we discuss, what works on social media, what works on Instagram, but we never delve deep into specific examples. And I like to think that the Invictimate community, the whole idea here is to bounce ideas off each other and to learn off of each other's quote unquote mistakes. There is never something wrong on social media. Well, there are some things, but majority of the time it's trial and error, and you kind of get to learn from others. So that's the whole idea of this new segment of the membership, which is case studies. Today we'll be looking at four main aspects of Instagram. We're going to be looking at bios. We're going to be looking at the highlights section. We're also going to be looking at the whole entire grid of the page, and we're going to be looking at specifically videos. What can be improved, what can be tweaked, what can be kind of better. A lot of you posted your own personal pages, so I've done an audit of all of these, and I've also combined a couple of kind of external pages that have worked really well on social media. So I'm going to be sharing those with you as well today and showing you why I think they had worked really well. So I'm going to share my screen and we can get started. Okay. Can everybody see my screen? I'll take that as a yes, hopefully.
Yes, yes.
Okay, perfect. Cool. So we can start. Dr. Shiva said she's going to be late. So we are going to be starting with Dr. Ikra's page today. So I want everybody to stop me from talking if you have a question. Dr. Ikra, I'd love for you to also unmute your mic and have an open discussion with me on what you think could go better for your page, what you think can be improved, etc. So awesome. So everything that I'm going to say today is not a criticism of these pages. All the pages that I saw today were fabulous. Everybody's doing a wonderful job. These are just ways to kind of help you take it to the next level. So to kind of explore each of the pages, I want to look at key aspects, starting with our bio here. So Dr. Ikra has done a really fabulous job of highlighting, exactly what she does here, with, a few kind of emojis that pop, and she's also linked her clinic over here. Now, where I think you can slightly tweak things and improve in terms of your bio. So fillers, Botox, skin boosters, wellness is kind of what almost every aesthetic doctor says in their bio. Now, most of the time, what I try to tell my clients when we're trying to kind of differentiate your page from the competition, let's say, is try to niche yourself. Be an expert at one thing. So, for example, if you're the fillers doctor, or if you're the Botox doctor, the skin boosters doctor, etc., try to make that your kind of key practice or your key slogan, let's say. It doesn't mean that you don't include the other aspects here, but try to differentiate one specific thing that you do. So, for example, I had an aesthetics doctor who did all of the above, but she was really, really good at lip filler. So she wrote the #1 Dubai lip filler doctor just at the top. Then she wrote the rest of her, kind of details. And then at the bottom, she had put like Botox. I don't know what she did. I think she did again, skin booster, facials, something. So that's definitely one tweak that I would make there, just because when people look at you as the number one thing for something niche and specific, they immediately kind of switch the thinking hat on.
Okay.
In terms of highlights, you've done a really wonderful job here, giving yourself a brand identity. Now, a lot of the time when I speak to people who are trying to build their own personal brand, when you're not a clinic, you're an esthetician, you want to build your own personal brand. So that means that you want to choose a set of colors and a set of fonts that speak to you and your specific personality. And it's done really, really wonderfully here. I can see this beigey kind of color, this minimalistic, really nice font used here. So really well done on these.
Thank you.
The only thing I would tweak here is, so these don't have names, although they are minimalistic and they're attractive to look at. Because our aim here is to convert patients, sometimes I actually would recommend putting a title, like a word, under each one. So for example, if it's, well, I suppose you had done it in these, you know, it's written in this way. I would also add it to down here as well. Just a
Mhm,
personal opinion. This isn't something that is like make or break.
mhm.
In terms of grid, let me try to do this. Yep. So when we look at the grid, so a lot of the time, grid doesn't really matter in the bigger scheme of things, right? When your content is getting pushed out to the mass media, your grid is not necessarily something that people will look at and, you know, they're going to be immediately switched off or on. Where it is really important is when your Instagram becomes a landing page for everything that you do. So let's say you're pushing your social media really nicely on your website, on your Google ads, maybe you're running meta ads, and a lot of the time, a lot of leads are landing on your page. It kind of becomes your own mini website. So you want a really holistic approach to your grid. So the way that you had done a really nice kind of a brand identity introduction, I would love to see it reflected just a little bit more in your grid. So I see a lot of kind of mismatched text styles. There isn't really much use of a little bit of text or a little bit of kind of minimalistic photos. And I'll show you examples of what I mean, but that is generally recommended to add a little bit more of this style of content just throughout, just to break the content up a little bit.
Mhm.
And then, so that's what I have in terms of bio, highlights, and grid. In terms of videos, really, really well done on those videos. Some awesome content that I'm seeing here. So I'm just going to share a few of the really successful pieces of content that I've seen in Dr. Ikra's page. She is an aesthetic celebrity doctor, and she does a lot of really kind of big topics that work on social media. So she talks about some celebrities and some really interesting thought-provoking topics in her practice. So I'll show you one example here with Taylor Swift since it's looking at me.
I must say, I am obsessed with Taylor Swift's new lip. It looks so natural, so aesthetically pleasing. This is by far the best lip filler that she's ever done. Her lip shape has.
So the reason that this works really well is because the style of content here is really modern. This green screen is something that you see everywhere on social media. She's also chosen, obviously, a very popular person here, a celebrity, Taylor Swift, and she's put all of her text in these kind of boxes that continuously move as she speaks. So this is a really, really successful piece of content here. It kind of grasps the attention of the general public, and it doesn't feel salesy at all. It doesn't feel like, come and, you know, get your lips done with me. No, instead it shows that Dr. Ikra is modern and with the time, which means that she understands what is aesthetically pleasing, which differentiates her from a lot of other aesthetic pages that might be a slightly older school. So she will get the younger population kind of thinking about her as an expert in the field. So she'll see a lot of conversions from videos of this style, and they do really well to be pushed out to the mass public due to the trending topics and trending subjects used in the video. Another one is Ozempic face. Of course, Ozempic is killer in social media at the moment. It's everybody's talking about Ozempic, so this is a huge one over here. I really like the hook here in this video.
Sunscreen or sunblock? Sunscreen.
So when you ask a rhetorical question like that, sunscreen or sunblock, there's movement in the video. There's a really nice hook there to kind of get everybody to watch, and then we get into the nitty-gritty of the topic. I also saw some really nice before and afters there. There's you presented one of
I know you've been.
one of the lip fillers in this with this trending sound. So instead of just showing before and after in the standard way, that was a really successful way of showcasing that as well. That is all I have to say about your page for the moment, Dr. Ikra. Let me know if you have any questions.
Thank you. Thank you very much. Very helpful. I was jotting down everything that you mentioned and definitely going to, tweak it a bit. But thank you so much.
Thank you. Awesome. Does anybody else have any questions or any further comments of maybe Dr. Ikra's page that I've missed, that maybe you jumped out at you? What do you think could work a little bit better, or what you think was really kind of nice on the page as well? Okay, cool. So we'll move on to the next one. So before I move on to one of the accounts that was mentioned on the group, I also want to share an account that is not part of the Invictamed community, but is an account that has done really well in terms of the style of videos that they have created. So again, the idea of the Invictamed community is that we give each other ideas and inspirations as well to spark new ideas, because I know a lot of the time when you're filming content, you just kind of feel like, oh my God, I'm doing the same thing. How can I change things? So this is the account of a spine surgeon. So it's a really, really complex practice, obviously, spine surgery, and it's not easily digested, I think, by a lot of people, because nobody wants to see a spine surgeon, right? It's the last thing you want. But the way that the content is done and the way that the account is organized as well. Oh, sorry. The grid has a kind of holistic take with this yellow and big style of text. And it takes a really young approach. Now, this is one of my clients as well. So you will see me in a few of these videos, but this account has done really, really well over the past couple of months after consistently posting. And I'm going to show you a couple of the really successful hooks that has worked. Feel free to note some of these down. What we'll do at the end as well, if we have some time, is we'll try to come up with a couple of hooks together to keep this really kind of to keep you thinking on the spot. So I'll give you a couple of topics and we'll all come up with a few hooks that you think could work for the videos. So here's one example. He's talking about 3 signs you may have spinal stenosis.
Have 3 signs you may have spinal stenosis. What?
Very simple hook. When you say 3 signs or 5 ways or 6 tips, people know what they're going into. They know what to expect in the video, and it's a really kind of strong hook as well. Another hook would be, let's do this one.
What are you looking at? Actually, this is
So this is called a POV hook. So when the person filming puts their hand in front of the camera and asks a question, that's a really, really interesting hook, because there's dynamic, there's movement in the filming, there's also a hand, and there's an audio behind the camera. So it's really stimulating for the viewer who's just kind of scrolling. So what are you looking at would be a really good example. Or, hey, what do you think about, etc., etc. So that's also a really successful hook. Another hook that works really well for these videos is to have 2 people standing in a video and going back and forth from these people. So, and I'm just going to show the example and then I'm going to explain it.
What's the difference between upper back pain and lower back pain?
What's the difference between upper back pain and lower back pain? So when you see there's that dynamic of the person moving and asking the question, it really works really well to hook the person watching. A lot of the time I find with doctors is that we're not exactly brave enough to have two people on camera. It just feels a bit awkward sometimes, but I'm going to show you the rest of this video, and it's about the style of filming. So you want the person to go from one POV to the other POV, from one POV to the other POV to work really well.
Well, this is a normal human spine. We have the neck and the lower back. Those are the two areas that move the most, and that's why they give us the most problems. If you experience pain in the thoracic spine, though, that may indicate an underlying problem that's far more serious. If you're young and you just pulled something in the gym, it's likely some painkillers and some stretches.
Okay, so it goes from one person to the other person. You might also notice that the videos always use props. There's always a spine, or there's a skeleton, or there's some prop. For some reason, that tends to work really well on social media. So if you're an aesthetics doctor, you always want to have your needles, or you want to be putting on gloves. You want to be, if you're talking about some sort of laser machine or laser technique, always have these things handy in your videos. For some reason, it really adds to the viewer's experience, and they're much more likely to watch the rest of the video or to continue watching the video through to the end. Anybody have any questions about this page so far, or anything regarding hooks in general, why they're valuable, or how to come up with a few more ideas? Okay. So we can then move on to our next example. We can do Dr. Rahman's page. Dr. Rahman, if I can have you also feel free to unmute. I know your son is around, but no stress. Just if you have any questions, feel free to stop me and I will stop and answer that question.
Easy, yeah. I'll definitely unmute when needed.
Okay.
Thank you.
Awesome.
Cheers.
Perfect. So for Dr. Rahman, so she is a chiropractic. She is outside of Dubai. So we're just going to have a holistic look of the page. Now, when I first landed on the page, it appears to be a clinic page. I understand you own your own clinic, if I'm not wrong.
That's correct, yeah.
Awesome. My only concern is that the team is perhaps not fully updated.
Yes, you're right. I've been asking them to send me their bio, so I'll message them now.
Okay, sounds good. So just because when I first landed on it, I was going to tell you to just add your name if it's you on the team at the moment, but since there is the rest of the team, absolutely present the team on the highlights section. Now, the first highlight, and I know it's hard to control where to put each highlight, right? Because it's by kind of the most recently updated highlight. That's the first one that gets pulled to the front bit here. However, when a person lands on your page, the first thing that they're going to look at is the very first highlight. Most of people will click the first highlight. So that's why I would really fix this as soon as you can. In terms of your bio, it's, I would say, a very, very good bio. It's informative. I would add the other practices if there are other practices within the clinic. So if it's chiropractic, possibly physio, etc. If it's only chiropractics, then I would also add a couple of perhaps techniques or pain points or something that makes you a different chiropractor. So you can say, I don't know, the best chiropractic in etc. Or you can say chiropractics that care, or give yourself something to differentiate yourself right when people first land on the page. In terms of the grid, so just like you had done your highlights, there's a very, very, very good sense of brand here. There is kind of these rounded edges everywhere you look. There's this beautiful green color that you've chosen. The font is consistent. So really well done on differentiating your brand. Now, the thing with social media and branding in general, people don't buy into people don't buy from you because you're discounting something, or because you've got a really good combination of treatments that you're giving. No, a lot of the time people are buying into you and into your brand and into how you present your own story. So if you're presenting your own story in this really clean aesthetic that's quite consistent all over your social media and all over your website, it works really, really well. So this is really, really good. Sorry, I keep looking over. I've got a couple of notes written down here. So I have noticed on your page.
Nala, sorry to interrupt, but there's a message on the WhatsApp group from Maryhan saying that, can you please let me in? I can't join the meeting.
Oh, sorry. Thank you so much. I've let her in. Sorry, Dr. Marahan. Perfect. Okay, so just to continue on, so I have noticed on this page there's a bit of an over focus on the use of static images, which is not necessarily a bad thing, but on social media, videos is really what video is what really drives your page, right? Your static stuff is going to be shown sometimes on the Explore page, but people scroll through Reels way more than they do static. So I would definitely focus a little bit less on static. My perfect concoction or my perfect mix would be to do a static every 3 Reels and to do approximately 14 to 16 Reels a month, which sounds like a lot, but a reel could be anywhere from 10 seconds to 60 seconds. So it doesn't have to be something major.
Sorry, did you say 14 reels per month? And
Yeah.
then 3 aesthetic, did you say, like in terms of posts, did you say 3 and then
So you
a
yes.
reel?
Yeah, so no. So you do 3 reels and then you put
Yeah.
one static to break up the content.
Okay, got it.
Yeah, so approximately, of course, it really depends on how you tweak your own page and how you create your thumbnails. That could really help aid beautify your content. But in terms of static posts, I would do it every 3, 4 reels or so. I wouldn't put a huge focus on it. If you want to continue these statics, I've seen this in a lot of pages. So what happens here is that you're not using the full scope of the canvas that you're given. Your son is so cute.
Yeah, sorry.
So what happens a lot of the time on these pages is that we're not using the full scope of the canvas that we're given. So although it's a very nice design with the phone, it's kind of squished together, so you can't really read it, and it doesn't grasp your attention as much as if the phone could possibly be designed here to the edge, and we see the writing put over here, where it's much more clear and much more obvious to kind of the viewer. Then to explore the videos a little bit more, so the videos posted are quite good. They are almost similar, I would say. A lot of them are quite similar in style, which is a style that really works for a chiropractic account, by the way, and chiropractic accounts in general do really, really well because people love to watch the cracks and the and the adjustments. So I would definitely 100% continue doing these. On top of these, though, I would add a couple of speaking videos because having spoken to you on a couple of sessions now, I have come to kind of understand that you're a very good speaker, and I would imagine that you have really, really awesome knowledge in your practice. So I would love to see that shine through a little bit more in your content. I would love for you to discuss a few topics. I know that there's a lot of controversy saying, neck adjustments are dangerous or back adjustments are dangerous. Don't shy away from addressing these topics. I would 100% go in with your knowledge and experience and explore that a little bit more. I would also do a few trending videos. So the ones that we saw from before, like with the green screen, I would definitely react to a couple of really kind of bizarre chiropractic videos. I've seen ones done on animals. I've seen some really cool content done surrounding this topic on social media. So I would just take the time to just find those videos and react to them. Put yourself in a green screen and it should do really, really well. And it should really get the account kind of out there. So that's my analysis of this page so far. Do you have any questions for me? Any concerns that you'd like to discuss further?
Yeah, sorry about my son, but the question or no is that in terms of me recording myself, the only reason why I haven't done that yet, and I've been wanting to, is because I find myself like cringe worthy. Like I start to cringe, like recording myself. I still haven't. It's not that I'm not confident. It's just that I'm putting myself up there talking. I'm just like, what is going on here?
I know,
Oh,
it's so awkward, isn't it? At the beginning, it's so awkward. You know, we always say it's like learning a new language. Like at the beginning, it's so awkward and you just want to, you don't want to do it. But 100%, I would say it's through doing it that cringe starts to go away. But that's a really good segue to I think Dr. Shiva wants to, yes, Dr. Marihan, I think you've raised your hand.
Yeah, I just want to say one thing to my colleague. Like, you should not feel like this because, like, now on social media, literally the one they have knowledge, they don't have knowledge. Just people talk, and you have knowledge, and you have something to let people know about it. So I'm pretty sure you will do amazing. You don't think about it. Just look around. I was talking to myself like people, they just talk. They don't have even knowledge. They talking.
True.
So you will do great.
100% agree.
thank you. Thank you so much.
100% agree. And I'm going to show you a quick couple of ways that you can start filming yourself by showing you this account. So it doesn't have to be that you're sitting behind a desk and you put a phone and you start speaking in this really like scary type of way. You can do it in much more fun ways at the beginning. And then later on, if you feel more confident, you could just start doing it the standard way of sitting, running the camera and having really cool edits on the video. But here's one of my clients. So this is Dr. Tamara. She's a GP, or she's a family medicine consultant, and she was really shy at the beginning to start filming this type of content. So what I suggest to my clients who don't have the bravery to kind of just start filming and editing and posting is do it in ways that are common on social media and that you see all the time and that are obvious to you. So one way would be to sit in a car while you're driving and just put a camera on the dashboard really safely, please. Don't, just keep it running and just keep driving, looking at the road and speaking. What happens is when you distract yourself by doing something else, one, it's an interesting way to consume content. So from a viewer's point of view, it's really interesting to look at, but also from a user perspective. So from your perspective, it's also easier because you're driving and you're saying all of these things as if you're speaking to a friend. So I'll show you one example of that.
I've been thinking, hello everyone. I've been thinking about how sometimes with my friends, we talk about these weird and wonderful things that we've learned through life to get us through daily living. And one of them is magnesium sulfate paste, God's gift on earth, and something that all of you should have in your bath.
So she's just speaking really, really kind of casually. There's nothing awkward about it. She's just kind of speaking as if she's on FaceTime with you, which feels really authentic to her personality as well. Another practice that we did, which, if you don't feel comfortable doing this, you don't have to, but another way to get more engagement from your page and to be a little less shy with your content is to create a little bit of personal content. So for example, Dr. Tamara went away, I think to London, and she didn't know how to film herself anymore. She just felt a little awkward. And I said, look, don't do a medical video, just do a personal video speaking about your traveling and your life, and your audience will appreciate that because it feels authentic and relatable. But at the same time, it kind of breaks the ice for you and gives you a new reason to start filming again. So I'll show you another example there.
I want you to stay.
So it was just a get ready with me, and the caption said, ever wondered what your doctor mom puts on her face with 10 minutes to spare? And this would be a really good one as well for all of my aesthetic doctors here today. This could be a really interesting one here to do. Get ready with me, what do you think I use on my face? Any dermatologists? This is a really wonderful style of video, which is really popular on social media as well. last one that I'm going to show, the last example that would be, I think, an easy start to doing your own content if you're a little bit shy about it, is to do a few trends that are quite simple. So I'm just going to share one with you just now. Yep, this one. So this is a trending sound on TikTok that I said to Dr. Tamara, and I said, just put some text to it. No need to speak, just put text, and that you will hear the audio and you'll see the text change. This is a really simple way to boost your confidence in creating content as well.
I went to a spot called the Filthy Ogre. What? What? Nothing. No, say it. It's fine. Keep going. Okay. Keep going. So he took me to the spot, and it was called the Filthy Ogre.
So a lot of this content might feel a little cringy at the beginning just because it's a little bit, it's really young content and it's really trending mostly on TikTok. But actually, Dr. Samara saw a huge rise in engagement because she had done that trend, and her patients were coming up to her in real life as well, really appreciating the content and saying, "I'm so glad I followed your page." So this is a really good kick start into creating content. Anybody have any questions regarding this account or Dr. Ramon's account as well so far?
I have a question, darling. So I assume the videos that she's recording, like in the car and stuff, does she use the selfie camera? Because, when I want to upload it, then the quality is not very good. Like, does she use a light or how she records the...
Very good question. She used to use the selfie camera. I said, don't use the selfie camera. If you've got your phone, don't let it face this way. Let it face the back camera.
But how then you know that you look good? Because you can't see yourself.
I know it's such a struggle, but you've just got to like put it in the perfect position, click record, you've got to test again and hope that you've done it again. So that's one way you can do that. Another way, so this is a really silly trick, but I've seen it on TikTok. So a lot of people, they'll just film in front of a mirror and they'll place their phone the opposite way, and then you're able to see your phone through the mirror. Now, some, especially non-iPhone users, they actually have a really good selfie camera. I didn't know that, but non-iPhones have really, really good selfie cameras. But if you're using an iPhone, honestly, I would highly rely on the back camera. Dr. Tamara specifically doesn't use any ring lights. I just tell her, please be next to really nice natural lighting. That generally works the best for me because a ring light can be a little bit harsh sometimes. Now, one thing that Dr. Tamara and a lot of the pages I saw today actually don't do is use a mic. I would heavily, heavily, heavily encourage everyone to invest in a mic. Now, after this,
Actually, that's another question I have. Because something happened to me. I don't know it's a technical issue or what.
Yeah.
I got these Rode mics, the small ones, which everybody's using, I assume. So what happened was when I record anything with the mic and then I go to Instagram, the automated captions doesn't show up afterwards when I upload the video. But when I record normally, the automated captions appear very well.
Oh,
this was something that I faced an issue before. Like when I use the mic, I don't know, it doesn't recognize my voice, or what is the issue? The automated captions, they don't work.
That is really strange. I've never had that issue. What I would suggest though, maybe try editing on CapCut. I've never edited on Instagram. I have edited on CapCut. Now, algorithms, both Instagram and TikTok, recognize that you're using CapCut, and they actually tend to boost your content when you're using CapCut.
I use CapCut actually. I have two applications. I have one CapCut and another one Videolip. But that one is easier to use. But I know everybody uses CapCut. I think CapCut is a bit more advanced, no?
We can do a session on completely CapCut. We can do like an entire...
Yeah, that would be good.
That could be an interesting one, but I would always tell anybody who's editing their own videos to use CapCut. I will look into, I'm just going to note it down, mic not being essentially recognized.
This is the issue I have.
For auto caption. So I've got a lot of designer friends, so I'm going to go ahead and ask them about that, and I'll get back to you.
The one which I have is Rode, which a photographer actually recommended to me.
Yeah. Yeah, I'm not 100% sure there. I will double check that and I'll get back to you with an answer on that. Now I'm going to link this in our group later on after the chat, but this is the mic that I would suggest using. It's slightly on the pricier side, but this is camera quality mic for phone, filmed material, and this is a really nice sound quality. Now, the thing about social media is that if you don't have really nice sound quality, your content is unlikely to be pushed to the greater public, because if people, are scrolling and something's not so obviously good to them and not so obviously entertaining and easily audible, they're just gonna skip. Dr. Marhan, I think you have a question. Sorry, I just noticed that you have your hand raised. No? Okay.
No, maybe from the last
from
time.
before. Sorry. Okay. Fabulous. So we can now move on to Dr. Mayhan's page, actually. Oh, sorry. Okay. So let's explore Dr. Mayhan's page a little bit here. So we've got a really nice bio here as well, and a really nice profile picture. This is something that I didn't explore in today's discussion too much. But of course, a profile picture is going to hugely aid your page. So we've got a nice one going on here, really nice handle. So the bio is really good. Aesthetic doctor in Dubai, member of the American Academy of Anti-Aging Medicine. Now, this is so important, especially in Dubai. When you're mentioning where you're trained, where you're from, etc., it's really important to the Dubai public specifically. In this market, they really care about where you're studied, where you're from, etc. So this is really successful. I have noticed, Dr. Marihan, that you had put hashtag Botox, hashtag fillers, hashtag laser skin, etc. I would remove the hashtags just because it's not aesthetically as pleasing. And also, when you hashtag in the bio, it doesn't actually tag the hashtag. So there's no reason to add the hashtag there. I would instead just put these lines in between: Botox, filler, laser, skin, hair care, etc. Perfect. So, and then I would also, similarly to what I had said before, I would think about niching a little bit. Now, for Dr. Tamara's page here, the one I discussed, she's a GP, right? So she's a general doctor, but she niched herself into a perimenopause specialist or a women's health specialist. So I would put this right front and center in the bio. Just choose something that you're really passionate about and really hone it in.
Okay.
Okay, fabulous. So in terms of the highlights are well done. I would say there's a really nice consistent color there. I would, however, increase the size of the letters here, or I would remove the words in general. Okay, so I would 100% put either a really nice picture or keep these, but keep them consistent. So don't have some writing in here and then none of this writing. I would also, so I would also remove the word treatment here and here because it's not really showing the rest of the word and it's not really needed. So laser, acne scar, lip filler, hair.
Okay.
Because for aesthetic pages specifically, we want to keep it as minimalistic as possible. You want the page to feel clean, almost like it smells kind of good. So in terms of the grid, I would say is quite good. It's quite consistent. I would say there's a clear favorite treatment here, which is definitely lip filler, which is really kind of reflected on the page a lot. So I would really think about reflecting lip filler and being excellent lip filler, the #1 doctor, doing lip filler in Dubai, etc. Something to that effect in the bio here.
Okay.
Now, there is a good reliance on static content here. There's some static content that's really awesome, and there's some stuff that I would tweak a little bit. So the stuff that works really well is something like this. I really like your use of arrows here, really clear. Picture says more than 1,000 words. Where I would tweak is something like this. This is a little bit of an older school type of editing where you don't use your whole canvas. Like I was saying before, you want to use, any space that you have. So you want to keep this maybe on top or this underneath or this on top, etc., so that they're right on top of each other. You can really clearly see the before and the after. I see a lot of successful aesthetic pages not even add the word before and after because you're meant to just look at it and you understand this is the before and this is the after. And it's a really clear reflection. Some of your thumbnails as well, I would start maybe designing the thumbnails a little bit more just because your face is getting cut off in some of them. So I would change that a little bit. Here, for example, this would have been a really nice chance to add some text because it's a really it's a really nice minimalistic picture, so you can really nicely add a couple of words maybe around here, laser treatment, skin something. I'm not sure what the treatment is, but you can add the treatment.
Okay.
So in terms of, sorry, let me see. Okay. In terms of the videos, you have some really nice successful hooks in your videos.
Hello everyone, I'm Dr. Mariha from Dr. Faiz Ghamam Clinic.
So this was a really successful hook for me because this motion of the two needles is something that's really like, whoa, what's going on to the average viewer? I know to probably aesthetic doctors, this is a normal thing to see, but for the average viewer to see, fluid going from needle to needle, this is really, really successful. Nice close-up shots here as well. So in aesthetics, you don't want to see really far away stuff. A lot of the time, people actually like seeing the needle going into the face. You don't want it to be too bloody or anything, but if it's a nice, clean incision, it's really nice for people to see. I also really liked your use of personal content. So this stuff really breaks up your doctor stuff and doesn't create the page to be too salesy. So this is a really successful video. So really, really well done on that video. I would highly suggest to anybody who's going to any conference, anything where you're furthering your research and your education, I would really, really highly suggest putting that forward on social media as well. People love to see it, and it's a true reflection of what you're doing as well. Fabulous. So the last comment that I have, Dr. Marhan, on your page is some of the content is not posted in the correct size. So this is one example. Oh, this is not one example. This is one example. So when you're posting content that isn't in real size, you're actually posting it as a post, not as a reel. And the thing about Instagram is that since the rise of TikTok, right, in 2020, the most popular type of video or content on Instagram is the reels. So when people are scrolling through reels, they're actually not going to be shown your video, which is just because it's such a beautiful video and it's really, really well done. It's just if it was cropped to the right size, it would have shown as a reel.
I didn't know that.
Okay. Awesome. So this is just the last minor tweak that I had on the page. Otherwise, really, really successful, beautiful page.
Thank you. Thank you. Thank you for your information. Thank you so much.
Thank you. Any questions regarding what I said or any further maybe comments that you want to add? Okay. Awesome. So we are running a little bit short on time, unfortunately. So I am going to do the last final page here. So we have got Dr. Mahela's page. So we're just going to explore this one as a last case study. We're going to be doing a lot of these case studies. So the idea is to learn from the other pages and to also follow up on the changes that we've kind of suggested in these sessions. And, throughout the weeks, hopefully we'll cover everybody's page and we'll learn from everybody's page. So Dr. Mahela, I'm not sure if she's still on the call with us. I believe you are.
I'm here.
You're here. Okay, awesome.
I was about to take your place if you were not here.
Sorry, Dr. Shiva, I will cover it in the next session.
No.
Awesome. So, Dr. Mahela, let's explore your bio a little bit. Doctor in Dubai, DHA license, and puts the DHA license. That's bang on. That's really, really awesome. So immediately you are set off as something that's completely different, and it immediately instills trust. What I don't see is the different types of perhaps treatments that you do, although I do see certified laser operator. So perhaps you want to differentiate yourself as a laser expert. I would make that just a little bit more obvious in your bio. I would also add a couple more emojis just because it just acts as a friendly kind of break off of color in the bio. I wouldn't overdo it so that it's not tacky, but I would definitely add, one or two emojis in there. In terms of the highlights section, there's not a clear brand identity here. So like I was saying before, you want to choose a type of font and a type of color that really kind of speaks to your personality, and I would add it here. I really like your segmentation though of the different highlights. I wouldn't add really long ones like here, but these are clean: sculpture, reviews, lips, etc., etc. Now, when I scrolled down, I was really happy to see these pinned videos. These are such a beautiful representation of exactly how the beginning of your page should look like. This is a textbook example of how it should be done. So first of all, there's a really nice consistency in these 3 videos. I would love to see these greens and these browns and this exact clean, beautiful font to be reflected right here. So if these are reflected right in your highlights, it would act as the perfect aesthetic page, I would say, especially from the get-go. So what Dr. Mahela has done here is she's kind of broken, first of all, who she is, the types of services that she's done, and a really interesting videos, which is what types of aesthetic treatments that she's done on her own self, which immediately, gets you going, oh, she's got a really cool personality. I really want to, keep scrolling on the page and exploring a little bit more. I just have a couple of tweaks on how the video is actually done. So we'll just go through the first one for a little bit.
Hello, welcome to my Instagram account. I'm a medical doctor with more than 12 years experience.
So the video is kind of similar. The rest of the video is similar to this hook or this beginning bit, which is a relatively good hook for this type of video because it's an introduction video. So you don't want to be too much about it. But what I would do is right after you say that, I would stop the video and do a really nice kind of montage of you working on patients, something dynamic, interesting with just music. And then we go back to the rest of the speaking video. What I've noticed in these 3 videos is that there's also no text when you're speaking. So I would love to have seen a huge text just here, exactly what you're saying, and with words kind of changing as you're saying them. The thing about social media is that it's a type of escapism, right? So people want to see what they're hearing and they want to hear what they're seeing, right? So we want really fast-moving, dynamic words there to keep the attention of the viewer. And we want to see, like I said, cuts in the video, right? So it doesn't have to be stock. It can just be your own content. It can be pictures, something dynamic. What I've also noticed in these 3 videos as well is that there's no background music. A lot of the time, some pages overdo it with the background music. You can't even hear what the person's saying. But if you have some really nice, subtle, maybe trending sound in the video, it does 2 things. One, it adds a really nice feeling to the video. Actually, the video's energy completely shifts based on the type of audio that you use. And 2, if it's a really trending audio, especially if it's a soft trending audio, a girly one maybe, it acts to actually further boost your video, right? Because your reel will get posted under that trending sound. Let's see, other notes that I've had. Okay, so when we look at the overall grid of Dr. Mahela's Instagram, it's really well done. It's really, really organized. I can see that you used to rely a lot more on static, but recently you've been doing a lot more videos, which is well done. The video completely, the videos completely revamped your page and made it so interesting. The only thing that I would change is I wouldn't stick to this very, very organized grid, although I know I've spoken a lot about brand identity and differentiating yourself as a brand with your colors and fonts and uniqueness. But if you make a really, really organized grid like this, it actually feels a little salesy. So I'll show another account that has done this just quickly. So this is a really, really successful dentist account, and it's a really, really nice one. Oh, and it's a lot of the videos. Oh, okay. So it's a really, really nice one, but this account used to be really organized with the type of grid that he had. So this acts immediately as somebody who's trying to sell you something, although he's an amazing dentist and his page is really, really successful. This feel doesn't invite the person to keep scrolling. Instead, what is an ideal grid to kind of do is to stay consistent with your brand without being too salesy about it or without being, too loud about your brand. So this account, maybe not in recent posts, but they used to really put really minimalistic text on their posts, and it really kind of sets them apart as a brand, right? So all you see in their page is these really soft pinks and beige colors, and you see flowers, especially for all the clinic owners that are here today as well. Feel free to showcase your clinic in this way. Take pictures of the shelves, and doctors here as well, if you want to show maybe your morning coffee, if you want to show maybe a chocolate or flowers that your patient has given you. Try to capture these little things as well and add them to your social media, because it breaks up your page in this really kind of minimalistic and modern look. So, Dr. Mahela, do you have any questions based on what I have mentioned for your page so far?
Not really. I mean, for the videos, I really like it. I do use my Instagram page as portfolio when the patient is already in the clinic, and I send them to numbing, and then they are able to scroll around and yeah. So and initially when I doing the static ones, it was kind of very easy to even catch whatever I need by myself, but now it does become a little bit overwhelming because there is a lot of different posts. So sometimes it's even hard for me to find certain things. So yeah, but I will take my time to adjust because it takes time to make a certain style, or it's not an easy thing, especially if you're doing yourself. But yeah, I'm definitely using this one more to educate my patients that are already in the clinic or who are coming as referrals. They can see my work rather than to catch people online at the moment. Yes. Or if they have a query for the clinic will share my Instagram, and this is how they decide to come as well. So yeah.
100%. Yeah, really, really successful. Even the static ones, I have no comments. Really well done, minimalistically done, wonderful. But I love, love, love the transition to the new content. Also, there's some really nice trending ones here as well. For Halloween, I saw
done by clinic, not by me.
No, I know, I saw.
I'm just a collaborator here. Yeah.
Yeah, but that was a really, really successful idea, I thought. So I'm glad they put you as a collaborator there as well. Awesome. So
Thank you.
Thank you. So how do I stop sharing? Okay, stop sharing. Cool. So that was all the accounts that I could cover today. I'm wondering if there's anybody that's got any questions for me so far based on what I have discussed, or in general about Instagram as well.
Can I talk?
Yeah, please.
For me, it's just like I think I'm overthinking. Like, does it look good? Like, should I post it? And then the second thing, like, even if I have material, like the editing, it's not like, I don't know, it takes forever for me because I'm not used to this.
Yeah.
And like example, where you're saying the green background and the videos and this, I wish if I can do it, but it's too complicated for me.
Not at all. Yeah, yeah. So I 100% understand your concern. It's a concern probably shared by 70% of the doctors out there. Dr. May is agreeing as well. Yeah. So what we have done in the past as well is we've done some sessions where we break down some of the the kind of easier like the green screen is actually meant to be an easier effect to apply. So what I can do going forward as well is we can make these sessions really interactive, and I can go through a couple of filters, the really easy to use ones like the green screen, or there's other ones, split screen, mixing a video. I can definitely walk you through a couple of these ways of editing a video. But at the beginning, honestly, I would go really, really, really simple. Don't do green screens. Don't do the really complicated stuff. Film a video. Try to cut the, in-betweeners, the ums and ahs. Sorry, and put some text on the video and just start and see what lands at first. Just test things out and then, see what lands. If you still think that it's too much work, we at Invictamed, we have a lot of contacts of different types of agencies and freelance people, etc., that we can definitely put you in touch with for whatever budget that you have in mind. But just feel free to message me or Servan, and I can definitely put forward a couple of people as well.
And then my last thing, like when I post, like I don't know, at some times, like I feel the page is too messy. Like I don't know, like this procedure, video, picture, and then when I'm trying to stick to certain pattern, like maybe I will not have the content. So there is any easy way, like to try to make the page look nice and not it's like it's messy or too much organized, like the clinic page, like how we can manage.
Yeah. So 100%. So what I tell my clients specifically who have this issue, because I've heard it before, I try to plan out for content, but that day I don't have the content and then I have to post something else and now it looks messy, etc. So this is really common. My number one advice is don't take it too seriously either. If the page feels a little bit messy, after a while you will get back your grid. So it's not an issue for it, like let's say for 2 weeks to look really a little bit jumbled up, and then you catch you catch it again. But definitely what I would do is I would just honestly take a piece of paper and I would just draw my grid and I would write a specific type of post that I want to see, right? So let's say, on this box, I want to see a reel with a before and after of any procedure. Then I want to do a static post, maybe a testimonial from a patient. And then I want to see this, and I want to see this, and I want to see this, and just try to kind of visualize it in your head, but keep your options open. As long as your page looks like your brand. So if you create your thumbnails to follow your own colors and text, honestly, it should never look that messy, even if the topics are not 100% coherent.
Thank you so much, Tim.
Thank you. Anybody else with any other questions? Okay, perfect. I think that wraps up today's session. Thank you so much for taking the time to come to this session, and I really, really hope to see you in the next one as well. I hope this one's been useful.
So I hope you're going to make more sessions like this with a little bit more technicalities, like tell us a lot of how to do things, since we're all old school. Yeah. So, and also if you can take today, look at our accounts and tell us all the mistakes that we've been guilty of, that would be great.
Sure. So what I'll do is all the pages that were missed, I'll give it a little audit on the group as well. And yeah, perfect. So I'll give you a couple of notes there, a couple of more tricks in writing. Sounds good. Thank you so much.